Welcome to Learn English with Saya.
Hello, everyone. Welcome to our English Learning Podcast. I'm Dr. Sarah, and today we're going to talk about doctor appointments. Doctor appointments. This is very important vocabulary for everyone.
Hi, I'm Mike. I'm a patient today. A patient is someone who sees a doctor. I'm here to learn and practice with you.
Perfect, Mike. Today's topic is very practical. Practical means useful in real life. Everyone needs to visit a doctor sometimes, right? So knowing this vocabulary in English is essential. Essential. Repeat. Essential.
Essential.
Good. Essential means very important. Necessary. You must know this. Today, we'll cover everything. Making an appointment, describing symptoms, understanding the doctor, and getting prescriptions. Are you ready?
Yes, I'm ready. This is very useful.
Excellent. Let's start with making an appointment. Part 1. Making an appointment. Mike, imagine you need to see a doctor. What's the first thing you do?
I call the doctor's office?
Exactly. You call the doctor's office. Office, the place where the doctor works. Let me teach you a typical phone conversation. Listen carefully. Receptionist says, "Good morning, Dr. Smith's office. How can I help you?"
And I say, I'd like to make an appointment.
Perfect. I'd like to make an appointment. Appointment. Repeat. Appointment.
Appointment.
An appointment is a scheduled meeting. Scheduled means planned for a specific time. You have an appointment at 3 p.m., for example. Now, the receptionist will ask, "What seems to be the problem?" This is a polite way to ask, "What's wrong? What's your health issue?"
So, I need to describe my symptoms?
Yes, symptoms. Symptoms are the signs of illness, signs that something is wrong. For example, pain, fever, cough, these are symptoms. Let me give you useful phrases. I have a sore throat. Sore throat. Repeat. Sore throat.
Sore throat.
Good. Other common symptoms. I have a headache. Headache means pain in your head. I have a fever. Fever means high body temperature. Your body is too hot. I have a cough. Cough is when you force air from your lungs, like this. Cough, cough. I feel dizzy. Dizzy means you feel like everything is spinning. Spinning. You can't balance well. These are common symptoms.
So I can say, I have a headache and fever?
Perfect! The receptionist might ask, "How long have you had these symptoms?" How long means what duration? 1 day, 3 days, a week. You answer, "For 3 days," or "since Monday." For and since are different. For is used with duration. For 3 days, for 2 weeks. Since is used with a starting point. Since Monday, since last week. Repeat. For 3 days.
For 3 days.
Good. Since Monday.
Since Monday.
Excellent. Then the receptionist says, "Can you come in tomorrow at 2 p.m.?" Come in means come to the office. Visit us. You can say, "Yes, that works for me," or "No, do you have anything earlier?" Earlier means before that time, sooner.
This is very useful. So, call the office, describe symptoms, choose a time.
Exactly. You've got it. Now, let's practice the full conversation together.
Part 2. Arrival and check-in. Now, Mike, you arrive at the doctor's office. You're at the reception desk. Reception desk. Repeat. Reception desk.
Reception desk.
The reception desk is where you check in, where you tell them you've arrived. The receptionist says, "Good afternoon. Do you have an appointment?" You say,
Yes, I have an appointment at 2 p.m.
Perfect. She might say, "What's your name, please?" You give your full name. Then she says, "Please have a seat. The doctor will be with you shortly." Shortly means soon, in a short time. Have a seat means sit down, please sit. So you sit in the waiting room. Waiting room. Repeat, waiting room.
Waiting room.
The waiting room is where patients wait before seeing the doctor. While you wait, you might need to fill out forms. Fill out forms. Repeat, fill out.
Fill out.
Fill out means complete, write information in. Medical forms ask about your medical history. Medical history means your past health problems, past illnesses. Also, current medications. Medications. Repeat, medications.
Medications.
Medications are medicines, drugs you take for health. Pills, tablets, any medicine. The form asks, are you currently taking any medications? Currently means now at this time. You write, yes, I take aspirin, or no, I don't take any medications. Also, allergies. Allergies. Repeat. Allergies.
Allergies.
Allergies are bad reactions to substances. Some people are allergic to peanuts, to penicillin, to bee stings. Allergic. If you have allergies, you must tell the doctor. Very important. This information could save your life.
Yes, I understand. Allergies are very important to mention.
Absolutely. After filling out the form, you wait. A nurse calls your name. Mike, the doctor will see you now. See you means meet with you, examine you. You follow the nurse to the examination room.
Part 3. Vital signs and examination. In the examination room, the nurse first takes your vital signs. Vital signs. Repeat. Vital signs.
Vital signs.
Vital signs are basic body measurements, basic health indicators. First, blood pressure. Blood pressure. Repeat. Blood pressure.
Blood pressure.
Blood pressure measures the force of blood in your arteries. Arteries. The nurse wraps a cuff around your arm. Cuff. Like a band. She pumps it up. It feels tight. She reads the numbers. Normal blood pressure is around 120/80. Second, temperature. She takes your temperature with a thermometer. Thermometer. Under your tongue. If you have a fever, your temperature is high. Normal is 98.6 degrees Fahrenheit or 37 degrees Celsius. Third, pulse. Pulse. Repeat. Pulse.
Pulse.
Your pulse is your heart rate, how fast your heart beats. She might count 70 beats per minute. That's normal. Some places also check weight and height. Weight and height. They ask you to step on the scale. Scale. To measure your weight. All of this is routine. Routine means standard, normal procedure.
So, vital signs are blood pressure, temperature, pulse, weight, height?
Exactly. Very good. The nurse writes everything down. Writes it in your chart. Chart. Your medical record. Then she says, the doctor will be right in. Right in means very soon. You wait a few minutes. The doctor knocks and enters. I enter and say, hello, Mike. I'm Dr. Sarah. Nice to meet you. What brings you in today?
What brings you in means, why are you here?
Yes, it's a friendly way to ask about your problem. You explain, I've been feeling sick for a few days. I have a sore throat and a fever. Then I start asking questions. Questions to diagnose you. Diagnose. Repeat. Diagnose.
Diagnose.
Diagnose means identify the illness, find out what's wrong. I ask, when did the symptoms start? You say, 3 days ago. I ask, have you been around anyone who's sick? Around means near, with. You might say, yes, my coworker had the flu. Flu. Repeat. Flu.
Flu.
Flu is influenza, a viral infection. Very common. Causes fever, body aches, sore throat. I continue. Any other symptoms? Cough? Runny nose? Runny nose. Repeat. Runny nose.
Runny nose.
A runny nose is when liquid comes from your nose. Mucus. Your nose is running. Very common with colds and flu. You might say, yes, I have a slight cough. Slight means small, not severe. Then I examine you. I say, let me take a look. Please open your mouth and say, ah. I look at your throat with a light. I might use a tongue depressor. Tongue depressor. A flat stick to push down your tongue.
This is what doctors always do.
Yes. Then I listen to your lungs. I use a stethoscope. Stethoscope. Repeat. Stethoscope.
Stethoscope.
A stethoscope is the instrument doctors use to listen to your heart and lungs. I place it on your back and chest. I say, take a deep breath in and out. Deep breath. Breathe deeply. In through your nose, out through your mouth. I'm listening for any abnormal sounds. Abnormal means not normal, unusual. If your lungs sound clear, that's good. Clear means no problems, no fluid, no blockage.
Part 4, Diagnosis and Treatment. After the examination, I give you the diagnosis. I might say, it looks like you have a viral infection, probably the flu. Viral infection. Repeat, viral infection.
Viral infection.
A virus causes viral infections, not bacteria. Bacteria are different. Bacterial infections need antibiotics. Antibiotics. Repeat, antibiotics.
Antibiotics.
Antibiotics are medicines that kill bacteria, like penicillin, amoxicillin. But antibiotics don't work for viruses. Many people don't know this. For viral infections like the flu, you need rest, fluids, and time. Your body fights the virus naturally. However, I can prescribe medicine for symptoms, for the fever, for the pain. I might say, I'm going to prescribe something for your fever and sore throat. Prescribe. Repeat, prescribe.
Prescribe.
Prescribe means write a medical order for medicine, the prescription. I write on a prescription pad. I might prescribe, take ibuprofen for fever and pain, 400 milligrams every 6 hours. Every 6 hours means 4 times per day. Milligrams is the dosage. Dosage. Repeat, dosage.
Dosage.
Dosage is the amount of medicine to take. How much and how often. Very important to follow the dosage. Too much medicine can be dangerous. Not enough won't help. I also give advice. Advice about self-care. Self-care. Taking care of yourself at home. I say get plenty of rest. Rest means sleep, relax, don't work. Drink lots of fluids. Fluids means water, juice, tea, soup. Stay hydrated. Hydrated. Repeat, hydrated.
Hydrated.
Hydrated means having enough water in your body. Very important when you're sick. You lose fluids through fever and sweating. Sweating. You must replace them. Drink, drink, drink. I continue. Avoid contact with others. You're contagious. Contagious. Repeat. Contagious.
Contagious.
Contagious means you can spread the illness to others. The virus can transfer from you to other people. Stay home. Don't go to work or school. This protects others. I might add, use over-the-counter medicine if needed. Over-the-counter. Repeat,
Over-the-counter.
Over-the-counter?
Over-the-counter medicines don't need a prescription. You can buy them at any pharmacy, like aspirin, cough syrup, throat lozenges. Lozenges, small tablets you suck on for a sore throat. Then I say, if symptoms don't improve in 3 to 5 days, or if they get worse, come back and see me. Get worse means become more severe, more serious. You might develop complications. Complications. Repeat. Complications.
Complications.
Complications are additional problems, secondary problems that develop from the first illness. For example, a bacterial infection after the flu, or pneumonia. These need different treatment, so you must monitor your symptoms. Monitor means watch carefully, pay attention to.
So, diagnose the problem, prescribe medicine if needed, give advice, tell when to come back?
Perfect summary. You understand the process completely. Part 5. Asking questions. Mike, as a patient, you should always ask questions. Always. If you don't understand something, ask. It's your health, your right to understand. Common questions patients ask. How long will I be sick? I might answer, usually 5 to 7 days for the flu. Usually means normally, typically. Another question, is this contagious? I answer, yes, very contagious for the first few days. Another, can I go to work? I might say, no, you should rest at home until the fever breaks. Fever breaks means the fever goes away, ends. Another, what about my family? Should they see a doctor? I might say, only if they develop symptoms. Otherwise, just have them wash their hands frequently. Frequently means often, many times.
Can I ask about side effects?
Absolutely. Side effects. Repeat. Side effects.
Side effects.
Side effects are unwanted effects from medicine. Every medicine has possible side effects. For example, ibuprofen might cause stomach upset. Upset stomach means nausea, discomfort in your stomach. You should ask, what are the side effects of this medicine? I'll tell you the common ones. Also ask, can I take this with food? Some medicines need food. Some need an empty stomach. Empty stomach means no food in your stomach. You haven't eaten recently. Very important to know. Another good question. Will this make me drowsy? Drowsy. Repeat. Drowsy.
Drowsy.
Drowsy means sleepy, tired. Some medicines cause drowsiness. You shouldn't drive if you're drowsy. Dangerous. So always ask. Ask everything. There are no stupid questions in medicine. No stupid questions. Your health is important. Part 6. Pharmacy and prescriptions. After our appointment, you take your prescription to the pharmacy. Pharmacy. Repeat. Pharmacy.
Pharmacy.
The pharmacy is where you get medicines, also called a drugstore. The person who prepares your medicine is a pharmacist. Pharmacist. Repeat. Pharmacist.
Pharmacist.
The pharmacist is a medicine expert. They can answer questions about your prescription. At the pharmacy, you give them the prescription. The pharmacist might ask, do you have insurance? Insurance. Health insurance. This helps pay for medicine and doctor visits. If you have insurance, give them your insurance card. They'll say, it will be ready in 15 minutes. Your copay is $10. Copay. Repeat. Copay.
Copay.
Copay is the amount you pay. Your insurance pays the rest. If you don't have insurance, you pay the full price. When your medicine is ready, the pharmacist explains, take 1 tablet twice a day with food. Twice a day means 2 times per day, morning and evening. With food means during a meal or right after eating. They might say, finish all the medicine even if you feel better. This is important for antibiotics, especially. You must complete the course. Complete means finish all of it. Don't stop early. The pharmacist also warns you. This may cause drowsiness. Don't drive or operate machinery. Operate machinery means use dangerous equipment because you might be sleepy and have an accident. They give you an information sheet, a paper with all details about the medicine. Read it. Read everything. Know what you're taking.
So the pharmacist is also very important, not just the doctor.
Exactly. Pharmacists are healthcare professionals too. They're experts in medicine. Use them. Ask them questions. They're there to help you. Part 7. Follow-up care. Sometimes you need a follow-up appointment. Follow-up. Repeat. Follow-up.
Follow-up.
A follow-up is another appointment after the first one to check your progress, to see if you're getting better. I might say, come back in 1 week for a follow-up. 1 week later, you return. I ask, how are you feeling? Are the symptoms better? You might say, yes, much better. The fever is gone and my throat doesn't hurt anymore. Gone means disappeared, not there anymore. I examine you again. If you're better, great. I say, you're recovering well. Continue the medicine for 2 more days, then stop. Recovering means getting better, healing. If you're not better, I investigate more. Investigate means look more carefully, do more tests. I might order blood tests. Blood tests, we take a sample of your blood and analyze it. Analyze means examine carefully. Test. Or I might order x-rays. X-rays are pictures of inside your body, like pictures of your lungs. Or a CT scan. CT scan. Repeat, CT scan.
CT scan.
A CT scan is a detailed picture using X-rays and computers, more detailed than regular X-rays. These tests help me diagnose you better, find the real problem. Maybe you have something more serious than the flu. More serious means worse, more dangerous. Then I treat that problem specifically. Specifically means exactly for that problem. The point is, follow-up is important. Don't skip it. Come back when the doctor tells you to come back. This ensures you recover completely.
Part 8. Emergency situations. Mike, sometimes you can't wait for an appointment. Sometimes it's an emergency. Emergency. Repeat. Emergency.
Emergency.
An emergency is a serious, dangerous situation. You need immediate help. Immediate means right now, right away. What are emergencies? Severe chest pain. Severe. Repeat. Severe.
Severe.
Severe means very serious, very bad, intense. Severe chest pain might be a heart attack. Heart attack. Very dangerous. Call 911 or go to the emergency room. Emergency room. Repeat. Emergency room.
Emergency room.
The emergency room, or ER, is the hospital department for emergencies. Open 24 hours. Other emergencies. Difficulty breathing. Breathing is hard. You can't get air. Choking. You can't breathe because something blocks your airway. Severe bleeding. Bleeding means losing blood. Severe bleeding won't stop. Unconsciousness. Unconscious means not awake. You can't wake up. Severe allergic reactions. Your throat swells. You can't breathe. High fever in babies.
For babies, a fever over 100.4 degrees Fahrenheit is serious. Sudden, severe headache. The worst headache of your life could be a stroke. Stroke. Blood problem in the brain. All these are emergencies. Don't wait. Call for help immediately. In the US, call 911. In the UK, call 999. In Europe, call 112. Know your country's emergency number.
So for serious symptoms, don't make an appointment. Go to the emergency room.
Exactly. Better safe than sorry. Better to go and it's nothing serious than to wait and it's something very serious. Trust your instincts. Instincts, your feeling, your intuition. If something feels very wrong, get help.
Part 9. Vocabulary Review. Let's review the key vocabulary. Key means most important, main. Are you ready, Mike?
Yes, ready to review.
Appointment.
A scheduled meeting with the doctor.
Symptoms.
Signs of illness like fever or pain.
Prescribe.
When a doctor writes an order for medicine.
Dosage.
The amount of medicine to take.
Contagious.
Can spread to other people.
Side effects.
Unwanted effects from medicine.
Pharmacy.
Where you get medicine.
Follow-up.
Another appointment to check progress.
Emergency.
A serious, dangerous situation needing immediate help.
Excellent. Perfect. You remembered everything. Now some medical phrases. I have a sore throat. Say it.
I have a sore throat.
I've been feeling sick for 3 days. Say it.
I've been feeling sick for 3 days.
How long will I be sick? Say it.
How long will I be sick?
What are the side effects? Say it.
What are the side effects?
Perfect pronunciation. Great job. Conclusion and final tips. Mike, we've covered so much today. Making appointments, describing symptoms, understanding the examination, getting prescriptions, asking questions, and knowing when it's an emergency. This vocabulary is essential for everyone. Essential. You never know when you'll need a doctor. Being prepared is important. Prepared means ready, having the knowledge you need.
This was so useful. I feel much more confident now.
That's wonderful. Remember, always be honest with your doctor. Tell us everything, even embarrassing things. Embarrassing means uncomfortable to talk about. We've heard it all. We're here to help, not to judge. Judge means criticize, think badly of you. Your health is private and important. Also, write down your symptoms before the appointment. Write when they started, how severe they are, what makes them better or worse. This helps the doctor diagnose you faster. Bring all your medications to show the doctor. All bottles, all pills. We need to see everything you're taking. And most importantly, ask questions. Always ask if you don't understand.
Great advice. Thank you, Dr. Sarah.
You're welcome. Everyone listening, practice this vocabulary. Role play with a friend. Pretend one person is the doctor, one is the patient. Practice the conversations we learned today. The more you practice, the more confident you'll be in a real situation. And remember, your health is your wealth. Wealth means riches, valuable things. Nothing is more valuable than your health. Take care of yourself.
Thank you so much. This was incredibly helpful.
Thank you, Mike. And thank you, everyone, for listening. Practice this English, stay healthy, and we'll see you in the next episode. Goodbye.
Goodbye, everyone. Stay healthy.